This podcast is by Alyssa Pritchard and is about HIV. HIV, aka human immunodeficiency virus, is a very serious virus that causes victims to have a compromised immune system, which in turn causes them to be less able to fight off infections. HIV is a human retrovirus that primarily targets helper T cells in the body. HIV transmission occurs in 8 different stages that occur as follows. The first being the extracellular virion stage. Following this, the GP120 protein then binds to host cell receptors. Then, HIV's genome reverse transcriptase, integrase, and protease enter the host cell. Reverse transcriptase then synthesizes HIV RNA into HIV DNA. HIV DNA is then spliced by integrase into the host genome, where HIV DNA is then transcribed into mRNA by the host. Following this, translation of HIV mRNA occurs, and it becomes HIV precursor proteins and later mature viral proteins. New HIVs are then able to assemble. HIV virins bud in the host cell membrane, causing the infection to continue to spread. There are many ways that HIV can be transmitted. However, the most common is sexual contact with an individual that is already infected, the sharing of needles or accidental exposure in the healthcare setting, contaminated blood transfusions, or the passage of the virus from mother to her infant. It is common that a person with HIV will be carrying the disease and be unaware of it for years because the symptoms are not present, and not everyone gets tested regularly. But as the virus takes over the body, the infected victim will begin to experience symptoms of other illnesses. For example, they could experience weight loss, an increase in cold sores, swollen glands, diarrhea that is very persistent, or tiredness. HIV can also develop into AIDS, which is acquired immune deficiency syndrome, and it causes the immune system to collapse. In AIDS, there is a heavily reduced concentration of CD4 cells. This causes a number of bacterial and fungal infections to develop in the body, some of which include pneumonia, tuberculosis, thrush, meningitis, and encephalitis. Without treatment, AIDS can be fatal. At this point, there is no cure for HIV because we are unable to develop a vaccine. HIV has a very high mutation rate, which means that it is able to develop many different strains, which then leads to resistance of medications. One way we can strive to defeat HIV is by using the method of early diagnosis, by testing those who are at high risk for contracting the virus. Early diagnosis is beneficial to everyone because it will help the person diagnosed by allowing them to begin antiretroviral medications, which will allow them to live a normal life. Antiretroviral therapy targets chain inhibitors, entry inhibitors, integrase inhibitors, protease inhibitors, and maturation inhibitors. And their partners can then begin to take PrEP, which is for people that do not have HIV but are at risk for getting it. It is greater than 90% effective if condoms are also being used alongside it. This drug uses reverse transcriptase inhibitors to work effectively. In the healthcare setting, it is important to understand and be able to recognize the signs of HIV and know how to support your patients. Nurses need to be comfortable and confident when talking to patients about HIV. If they do this, the condition will become more of a normal thing, and the public will be more willing to get tested, and people will be more open to having conversations about HIV. It is important to educate all patients about HIV because there have been studies showing that people that refuse to get tested are 3 times more likely to contract the disease. Because they refuse to get tested, they are then putting other people at risk because they could have the disease and be completely unaware of the damage that is happening inside of their bodies and the virus they are passing around. Overall, it is possible to reduce the number of cases and deaths from HIV by simply advertising testing of the virus, and in turn, that will lead to early diagnosis, and the healthcare workers will be able to help the patient in a greater way. Regular testing is vital in solving this problem and will reduce the number of deaths from this virus, and hopefully it will eventually not have to worry people that partake in activities that put them at a higher risk for this virus. Antiretroviral therapy is doing a good job of helping victims survive and live healthy, long lives right now. But it is important to understand that our world is constantly changing, which means that viruses are also changing and becoming more difficult to treat. If you are a male or female and sexually active, it is important for you to be aware of the risk that you are putting yourself at and your partner at. Healthcare workers need to be aware that accidents happen and needles slip sometimes, and they could become infected that way, but they also need to take the correct precautions to protect themselves from those accidents at all times. Expecting mothers also need to be on high alert and need to be constantly having conversations with their doctors if they have HIV, and discussing the safest way possible to have a child and to allow that child to live a healthy and happy life. The problem with HIV does not have a simple solution. However, if we all work together, we can work on reducing the number of cases that occur and possibly getting rid of the virus altogether, or at least have it become less threatening to human lives. The only way to do this is to educate the public on the risks and the signs and symptoms so they are aware of how important it is to get tested regularly and are aware of how to support people in their lives that could have the virus.